afternoon, everybody. First, I want to express my appreciation to Tom. Where'd you go, Tom? There he is. Kuzmarski. I always have a hard time with that. Tom, thank you. And Dan Miller and the entire Chicago Innovation Awards folks for all the work you do in highlighting and celebrating innovation in Chicago. I'm also grateful to Howard Males, chair of our Cook County Economic Development Advisory Committee, for introducing me to the Innovation Awards and for bringing us together here today. Terry Howerton and Kevin, or are Kevin and Howard, Terry here, I'm sorry? Okay, so we have a couple members of the Council of Economic Advisors who might join us later. I also want to congratulate all our 2015 award winners who are with us. Once we hear about your innovations, I'll ask my staff to follow up and make sure that you connect with each other. The connection might be to offer resources or something as simple as feedback on your innovation. And next year, I'd like to hear an update about the impact of this work. Now I'd like to turn the program over to Tom. There you go, Tom, who I think is going to handle the rest of the show. Thank you.
Thank you very much.
Thank you.
Well, she's done a lot for the entire region, and we're grateful for what she's also done for all of our innovators here in Chicago and in the Chicago region overall. So if you remember back 15 years ago when Dan Miller and I started the Chicago Innovation Awards, it really was aimed at doing two major things. The first was to give credit to the entire Chicago region for all the amazing work that's going on here. And secondly was to try to change the narrative, to make sure that people throughout the country understood the great new businesses, new services, new products, new business models that were underway here in the Midwest region. Over the years, these innovators have done some amazing things. And so I just want to share with you a couple of statistics on the breadth of innovation, which I think defines the whole Chicagoland region in a most unique and differentiated way. In the past 14 years, we've had 140 winners. Those 140 winners are all in business today. 100% of them are still in business today. In addition, 35 of those have been acquired for an exit value of now over $62 billion. So it certainly is a testament also to the economic value that can be created when companies and organizations are truly innovative. So we're delighted to see today how the county, once again, can be a great partner with these winners as we're all seeking to grow and further advance. And now what I'd like to do is ask each of you, we'll go around the room one by one, if you can kind of give a 1 to 2 minute synopsis of this past year's successful new product, service, business, whatever your winning innovation was. And then also, if you'd like to share with President Preckwinkle and her staff any ideas that you may have in terms of how you and the county could even work together would be great.
So hello, President Preckwinkle. I am representing the 606, which is an elevated 3-mile trail and park system on the northwest side. And I had the great good fortune of being a partner with the county on this project. It's a $95 million infrastructure project that took 38 bridges, repaired them, connected them, and we now have an extraordinary new park and trail system. The county was one of the contributors to the project, and we've been working with the county forest preserves in innovative ways as well. So thank you. We won the People's Choice Award as part of this year's Chicago Innovation Award. So very grateful for the recognition and the partnership with the county.
Hi, my name's Alex Smith, and I'm one of the co-founders and the chief product officer of Ampy. And Ampy, A-M-P-Y. We make a device that captures the energy from your movement throughout the day and turns it into power for your phone. So if you can see, I'm shaking the device here, and you can see I'm actually producing electricity. So this is enough to power your phone, exactly. So an hour of exercise can produce up to 5 hours of standby time for your phone, which is about an hour of typical use. So just over a year ago, we launched a Kickstarter campaign, raised $300,000, and then went oh no, we have to make this thing, we were able to fulfill, and in the last year we've fulfilled all of the Kickstarter units, and we're on sale on Amazon. We see this product as not only an external battery pack that you can recharge yourself, we see it as a motivation to move and as a wellness device. And so my ask for you is any connections that you might have for wellness programs in the Chicagoland area that might be able to benefit from having AMPI be part of that program. Thank you.
Hi, President Preckwinkle. My name is Greg Topol. I'm CEO of Tanvis. We are a Northwestern spinout, and essentially we have a technology that enables you to, a Northwestern startup spun out 5 years ago, and we have a technology that enables you to feel what you see on a touchscreen. So our technology not only can create textures and clicks and interactions, we can provide a way for people with vision impairment to navigate a display device. We have ways where education becomes more rich with the sense of touch. But really our claim to fame is just making interactions that you do on a daily basis more incredible, because you can actually physically interact with the device rather than touching a flat piece of glass.
Have you got a sample? I mean, have you got
I do have a sample. I didn't know if...
Yeah.
Scan your finger across there, and the glass is not moving. What we're actually doing is capacitively coupling your skin.
We're capacitively coupling your skin into the screen, and so you can actually physically interact with things. So we have an application here where, imagine the next time you buy a pair of corduroy pants, you can feel them before you buy them. That's right. So our ask is actually more of just a sense of awareness. We are working with several different organizations here in Chicago and obviously worldwide as well. But just mostly, I'd love the opportunity for us to maybe talk a little bit later down the line when we do have a more specific application in mind.
Hello, my name is Brian Gratch. I'm co-founder of the company Zaptum. That's X-A-P-T-U-M. And we're in the Internet of Things space. We've effectively created an internet for machines. So in the Internet of Things world, you need sensors and devices to talk to back-end cloud applications, and we make sure all those messages move back and forth securely, reliably, at massive scale. So in particular for cities and governments in the smart city space, there's a lot of concern about security, particularly with when we're connecting street lamps and buses and I don't know, just everything related to a city, right? And so all of that information needs to be moved to back-end systems smoothly and reliably. And so that's what we do. We work with companies such as Cisco and Nokia and Ericsson and Dell and companies like that. And our lead board member is a guy named Hardik Bhatt, who is the CIO for the state of Illinois. So we get a lot of good insight, especially on Smart City.
Hi there, I'm Josh Middleman. I'm the Chief Operating Officer and co-founder of a startup called Relief Watch. And what we do is we capture sales distribution data from workers in the field in emerging markets. So the biggest challenge that organizations, whether they be private sector or health-based in emerging markets, the biggest challenge they face is actually knowing what their supplies are downstream in the last mile. So whether you're a health clinic in the middle of Honduras or you're a small shop selling Dove soap, the companies knowing what's available at that shop level and what the salespeople are moving out throughout the distribution chain is vital to preventing stockouts and ensuring that people have the kind of livelihoods that would allow for those products to move and for people to continue to buy them. So we do this through a pretty innovative approach, I think, which is we use basic mobile phones. So while everyone in this room probably has a smartphone and is using mobile data from the grid here, 90% of the developing world has access to basic mobile phones, which is a black and white screen with a keypad. And so we actually use that, leverage that, in addition to some other mobile app technology to capture this data and allow organizations to analyze it. So this is maybe not a fit for the more developed countries in the world. But I definitely am here to make it aware that this kind of innovation exists in Chicago.
Hi, my name is Ross Benayer. I'm the founder of Extenet Systems, which is a distributed networking company. It's an alternative technology for deploying wireless signals, both outdoor and in. Our biggest challenge in terms of deploying our outdoor networks is municipal approvals. We have had a number of deals, particularly here in Illinois, that ended up not going forward because of the time it took to get municipal approvals to deploy our technology. And so we're deploying radio access gear on utility poles, traffic lights, street lights, connecting it all with fiber optic cable in order to provide cellular signal throughout an area, be it the city of Chicago or suburbs or wherever. And we also do that on in-building as well, because now people want to be able to use their phones regardless of where they're at. It's connection anytime, anywhere. We were funded in 2004, so we've been around for a while. So we're really designed to enable all these things you just heard about as well.
And how many unicorns are there in?
I think 4, you told me.
I'm sorry, so you have to explain to me what a unicorn is?
Ross, can you get
Ross, yeah.
can you get cell phone service in the basement of this building? It's about 3 stories below the.
Probably not.
But if Extenet were
Yeah.
providing service, you can get it anywhere.
Yeah.
And
And we
explain what
have
a unicorn is?
a company that has $1 billion valuation.
Yep.
And so you do?
We do.
Okay, all right.
I'm Blair Locke, co-founder of a company called Coapt, and we were the winner this year of the Collaboration Award. Our company is relatively young, but our technology and what we do and sell has been around under development in the Chicago area for about a decade. What we do here in Cook County, proud to say that, is we are the company that does this. We're the only people in the world that do what we do. We make a control system, a lot of technology here, but ours is medical related. It's for amputees, for people that want to use powered prosthetic devices. Our system decodes their brain signals to allow them to control prosthetic devices.
Hold it up, Ross.
Sure. We don't make the hand. Lots of other people do the parts and pieces. We make the brain. So the electronics that are inside the system that sit between the person and the device allows them to use it very naturally. We're the only people in the world that do that and have had great success here in the county. Our bottom line is really affected by the insurance coverage for our users. And our question is a little broader than maybe just the Chicago area, but when it comes to new things to us, such as the state-run healthcare marketplaces, different states are doing different things, and we see Illinois it has a few challenges compared to a few other states, and we'd love to know if there's a way we could be in contact with somebody in the state-run marketplace to learn a little more information for our users.
All right.
My name is Jason Ketchum. I work for a company called Context Media Health. We have a suite of products and services that takes a patient, typically with a chronic condition, through their continuum of care. So we have waiting room, exam room, and infusion room capabilities.
I'm sorry, say this again?
Yeah, no problem. So we have a suite of devices that takes a patient through their continuum of care. So if you walk into a physician practice and you have type 2 diabetes, there would be a TV screen, flat panel connected to the internet to share contextually relevant information with you, a Wi-Fi product that can connect you and make sure that you can share information back with your provider. In the exam room, there's a digital wallboard that provider can use to help facilitate that conversation. And we have an exam room tablet, which is what we actually won for a new product, which is an intimate one-to-one media device to learn exactly what you should talk to your healthcare provider about immediately before the appointment. With the idea being that an empowered patient can start to make the right decisions and really create a sense of community inside of that healthcare practice. So a patient is really comfortable with that conversation and really drive a positive outcome as a result. So we work with some of the larger healthcare systems across the country. We've been around for about 10 years. And we would love to actually talk a little bit more about working more closely with the county and some of the county hospitals.
Hello, President Preckwinkle. I'm Ken Green. I'm the Senior Director of Market Development for Comcast, primarily on the business side. We're a sponsor also for the Innovation Award have been for a number of years. And one of the things that I see, especially here, a lot of the gadget providers directly relate to a lot of the things that Comcast does. So I think if I look at this in relative terms to Cook County, in a lot of cases, my team does a lot of different things, but if you take a look at some of the projects that we do in Cook County, one of the terms that we hear a lot is a demand for gigabit speed internet connectivity, right? So we have done a lot of economic investment in a number of different areas throughout Cook County. Specifically, we're doing a major investment in the West Loop this year, and then we'll continue into the Loop. But we also do a variety of different investments in the community in general. And most of that is infrastructure deployment as it takes a look at scalable networks. So as you have different devices that do connect to the internet and distribute a lot of data across those networks, scalable networks starts to become pretty critical as businesses or even residential communities take a look at it. So we're doing a lot of that just physical investment in deploying a lot of new fiber optic networks in some of those corridors that are maybe underserved today.
Hi, I'm Syed Karim. I'm the founder of Outernet. Outernet is a broadcast data service. What we do is we take content and information that's normally found only online and make it accessible to places that do not have access to the internet. So it's a globally accessible service that provides news, information, and education, primarily targeting the developing world, but it has accessibility or utility all over the world. So my ask is that we currently operate a system, both we make hardware as well as run the broadcast service. I don't want to continue making hardware in China, and I would like to know how it is that I can actually manufacture it over here and what kind of resource available. Investors don't want to fund a factory here, but I think that's important for us to have tighter feedback loops, better engineering, and better products.
Madam President, Brian Abrahams, I'm Vice President for Communications for Avant. Our goal is to lower the barriers and costs of borrowing money for working middle-class Americans. Surveys show that 63% of Americans do not have access to $500 or $1,000 for an emergency need.
You're going to replace our awful payday loan places? Is that what you're going to do?
That would be the goal. I mean, we have over half the country has FICO scores under 700 and can't borrow from their local bank. So our goal is, by using a tremendous amount of data to judge people, to evaluate people and be a platform for underwriting the loans, that many more people have access to credit and then can improve their credit scores if they pay off the loans. We are the second fastest growing tech company in Chicago history after Groupon. We're currently the best funded startup in Illinois, and we've created almost 900 jobs in the city of Chicago in the last 3 years and currently.
Hi, I'm Ann Skatulski. I'm here on behalf of Opternative. Opternative invented the world's first online eye exam. What that means is healthy adults ages 18 to 40 can now receive an accurate, physician-reviewed prescription for glasses or contacts online in 24 hours and for about half the price of a traditional in-office experience. Our mission is to help the world see and feel better, because we believe that without proper vision correction, people can't necessarily live up to their full potential in life, and we want everyone to lead as fulfilling lives as possible, and through proper vision correction, we might be able to help them do that. So our ask for the for the county is to connect with the health and hospital system in two different ways. One, to connect us with potential patients, because I think there's enormous opportunity here for underserved communities and lower income communities because of the low cost of our exam, as well as connecting us with providers. I think we have an opportunity to potentially save the county health systems money, specifically if there are ophthalmologists who are working for the Cook County Health and Hospital System. They're currently spending time on what is really a simple service, a refraction, that as Opternative has proven, you can now do accurately and remotely. It'll free up those ophthalmologists' time to be really providing more complex medical services for people who need it most. So we appreciate your time.
Good afternoon. I'm Christopher Flynn, co-founder of Infiniteach. I spent the last 20 years of my Infiniteach.
Okay.
Spent the last 20 years of my career here in Cook County working on behalf of children and families suffering from autism. And we've developed an iPad app that helps kids with autism further their academic and social skills. It allows them to customize lessons based on their interests and attention span, and also keeps data to prove the efficacy of the products. So we launched that a few months ago, and we have 2 asks for the county. One would be to let as many schools and families know about this product as possible. It's a product that's has tremendous efficacy. A lot of expertise has gone into building this, and there's a lot of families in need. Today, 1 in 45 kids are being diagnosed with autism. So there's a tremendous need here in Cook County as well as across the country for a product like this. And our second ask would be for, we're working on accessibility projects with some of the zoos and other institutions here in Cook County to help them become more accessible for kids with autism. And so introductions to those places that want to increase their accessibility would be helpful as well.
All right, so our health and hospital system, who's got connections to our educators besides you? You should see me too.
Yeah, for sure. History teacher.
Yes, you should see me, okay?
Hello, my name is Boral Reldrick. I'm with Abbott Labs. Abbott's a 128-year-old company that was founded in Ravenswood here in Chicago. It's about $56 billion. Worldwide healthcare company with pretty large product lines. We go from nutritionals like Similac, diagnostic equipment, devices, and in other locations we sell generic drugs, not here in the United States. The innovation that we were awarded for was called MitraClip. MitraClip is a medical device that repairs leaky mitral heart valves. So that's basically what happens is that blood flows backwards within the heart's chambers, and this device, rather than going through open heart surgery, is a medical device that is delivered via catheter through the leg and clips the flaps of that leaky valve, preventing the blood from flowing backwards. It's been delivered to over 25,000 people around the world. Abbott does not have a specific ask, but I'm sure that if an issue arises, we'll be there to see it.
Hi, my name is Andrea Shrestha. I'm one of the co-founders of Luminade. We were actually here last year as part of the Up and Comers group, so it's great to have a seat at the table again. Yeah, so that's one of the bigger developments. So we're still pretty small. It's a full-time team of 4, but we've been steadily growing our sales team, and we have a pretty healthy internship program. So we've got people from U Chicago, which is where I'm also a student, and DePaul, and it's been great to find people here to come and work for our business. This is actually an updated version. We've now released a couple of new versions of, we've got different shapes, sizes, and colors. I brought this one because we also print logos on this, so plug for the rest of the room. If anyone needs a cool promotional item or gift for customers, we will happily print your logo on our lights. And I'll just do a quick demo.
While she's doing that, I bought 2 for Christmas presents, and they're just great. It also took up about 10 minutes for the kids to figure out how to blow it up. Maria's doing it a lot. Yes.
Yeah, so the idea is this charges in the sun, 7 to 10 hours of charge, and then it packs flat so you can charge it on the go. You blow it up, it's waterproof, and it floats, and then you get up to 30 hours of LED light. And we've sold these for camping, disaster relief aid. This past year was very busy due to things like the Nepal earthquake. And then I guess my ask today in the county is, we've been in touch before with the Cook County Department of Homeland Security. It was a while ago, and the people that I was in touch with, they kind of moved around on the team, so I would love to reconnect with them. And we're a certified supplier with Grainger, so we're already all set up, and so I'd love to just get back in touch with them.
Hi, I'm Patrick Spain. I'm the CEO and co-founder of First Stop Health, located in the East Loop. We do telemedicine. Telemedicine is the ability for you as a patient to talk to a doctor if you use our service, usually in under 5 minutes, to get treatment of common non-emergent conditions such as pink eye, upper respiratory infections, and what have you. We address the 2 issues in the healthcare system that are crippling it: rising costs and lack of availability of primary care physicians. We're licensed in all, we have physicians licensed in all 50 states and the District of Columbia. And we would love the county with 22,000 employees to become one of our customers. It's a great benefit for employees, and unlike the other benefits where you pay, we guarantee you that it will cost you nothing. It will actually save you money because we will divert people from emergency rooms and physicians' offices to a telephone call. Thank you.
All right, is that everybody? Okay. So, first of all, I want to thank all of you for coming. I realize that there's some people who have, half a dozen folks that are supposed to see them. Hopefully they've got lots of cards and can arrange follow-up meetings. There we go. Our goal is to try to be helpful to you in any way that we can. And so my staff is here to have follow-up meetings and to make connections for you as we're able. Okay? So I want to thank Tom and Dan again for doing this. And I want to thank you, Howard, for making it possible. Howard introduced me, as I said in my opening remarks, to this organization and its good work, and I'm grateful to him.
Thank you.
Okay?
Will you repay it with the photo of the group?
I would be happy to. I would be happy to.
Fantastic.
Okay?
Thank you.
All right, thank you.